In recent years, more and more doctors have started using electronic medical records to store their patients' information, and it's happening right here in Torrance. Reporter Denise Salazar has more on the story.
Dr. Paul Murata, a family physician of the Medical Institute of Little Company of Mary, has been using electronic medical records for over 2 years. He says this new form of storing records has improved patient care.
Well, I think the best features about the electronic medical record is one, retrieving information much more quickly. Second is it allows you to track things like cancer screening procedures to see when they last had them done, or if they've even had it done.
Dr. Murata says the positive changes may not be as obvious to his patients, but says they're starting to realize that the transmission of information is faster. Jens Majet, one of Dr. Murata's patients, has noticed the change.
Basically, it's faster, I think, and it's just convenient that he can have all the records with him in the laptop instead of going back and forth to some file cabinet somewhere and look for it.
The U.S. Department of Health and Human Services recently adopted an initiative to convert paper health records to electronic. It hopes that it will lower costs, improve efficiency, and reduce medical mistakes. Carolyn Daddario, practice manager at the Medical Institute, says those benefits are already happening.
We've had our challenges, but 2 years later we have seen marked improvement in patient volume, how many patients we see a day, more efficient progress notes, accurate, more legible.
Marissa Gamatero, a nurse at the Medical Institute, says she has seen communication between doctors and patients improve.
Patients like it because, especially with their prescriptions, they're legible. They can read the prescriptions versus when they were handwritten.
In addition, the electronic medical record system checks to make sure there aren't any bad drug interactions between the other medicines a patient may be taking. Reporting for This Week in Torrance, I'm Denise Salazar.
Thanks, Denise. So far, 80% of the records at the Medical Institute are all electronic and expect to convert the remaining files within the next 3 years.
As technology